Hi, this is Dr. Whitcomb, and I've got good news for fibromyalgia, trigeminalgia, and RSD sufferers. Today, we're going to talk about why you feel like you do. Why are you in so much pain? Why are you so depressed? Why are you foggy-minded? So let me explain it like this. Fibromyalgia, and like always, this is my work, my beliefs, and we've been doing this for 20 years. We've got thousands of people who have responded to treatment, and I believe that we found the cause of fibromyalgia. And I'll tell you why I believe that is because I've got a test for fibromyalgia, and that test alleviates most or all of the symptoms at the time of testing for almost everybody. So if it doesn't alleviate a significant amount of symptoms, you probably don't have fibromyalgia. You probably have something else. So this is what I believe causes it. I believe that fibromyalgia is a compression upon the meninges in the upper cervical spine, and that takes place typically by way of an accident and some type of injury, a surgery, maybe even a heavy emotional trauma. I've seen people get fibromyalgia during a divorce. So when you put pressure on that meninges, it pulls it out of its normal juxtaposition. It moves it from where it should be. All of the nerves, almost every nerve in the body, goes from the brain and the spinal cord through the meninges to get to your body. So when you pull on that nerve, you're pulling on when you're pulling on that meninges, you're pulling on nerves. If you reach over here and touch your ulnar nerve, or if you happen to hit it on the table, it'll make these two fingers hurt or go numb or both. But you didn't do anything to these fingers. You hit the nerve here. If you pull on the meninges up here, where those nerves go, you will have symptoms. That's why it typically starts with the neck and shoulders. And as the compression gets worse, it pulls on the meninges enough to affect the nerves all the way down the spinal cord, and it can affect every part of your body all at one time. Let's put something into like more of a capitalization. If you pull on enough nerves, you're firing so many nerves to your brain that you can't think. If it's your computer and you give it too much to do, it gets really slow and it doesn't work well and you get frustrated. That's called RAM, random access memory. It's so much for this to do that it can't do it. When you send enough impulses to your brain, you can't function. It is overloaded. You get what we call fibrofog. And that fibrofog keeps you from being able to think clearly and do the things you need to do in the day. Here's the other thing that happens. You pull on enough nerves, it puts you into sympathetic mode. You've got parasympathetic that helps you relax, it helps you eat, it helps you make love, and those type of things. You've got the sympathetic that's really made to help you to run, to fight, to get out of trouble, to have extra energy. Your blood pressure goes up. It shuts your intestines down. It does a number of things. So let's look at it like this. So let's say you've got your sympathetic flowing. Your blood pressure is up. You now don't have good eating, digestion because your intestinal system is shut down. So they might give you a diagnosis of irritable bowel syndrome. So now you've got irritable bowel syndrome. You're all cranked up, your blood pressure's up, so maybe somebody's giving you some kind of medication for your blood pressure. And now you live like this with fibromyalgia. It just doesn't come on and off. For almost everybody, it stays on all the time. When it's on, you're alert, you're vigilant. You don't sleep well because you're in sympathetic mode and you're fired up and you're ready to go. So you don't sleep. You have anxiety that goes along with the sympathetic. It gives you anxiety so you can get pumped up and going. So now you have anxiety, you have irritable bowel syndrome, you have insomnia, you get so fatigued that now you have fatigue. All of those things are all coupled around just one simple thing, turning the sympathetic nervous system on. It's a good thing to turn on, but you don't want to live with it. And if you've got fibromyalgia, chances are your sympathetic is running full blast all the time, and people wonder why you look so miserably tired. You don't look like you're in sympathetic. You look like you're about to fall over. And that's because you haven't had a good night's sleep, maybe in years. I can remember when I had fibromyalgia, I'd be awake all night. I'd be close my eyes, try to sleep. I couldn't sleep. I open my eyes and look at the clock. It's like 4:30. I finally fall asleep. I wake up. I think, well, I finally sleep. Now it's 4:32. It's crazy. And the level of fatigue is so incredible that it becomes almost unbearable to live just because of the fatigue alone. Forget about everything else. Now, let's see. I want to make sure I didn't miss anything. Nervousness, irritability, anxiety, depression comes from being so tired. Fatigue, irritable bowel syndrome, all of those things go together with just the sympathetic running all by itself. Now, let's throw something else in there. You've got nerves firing. You've got nerves firing, and your whole hand might be numb. Your whole arm, maybe both your arms are numb, or both your arms are in severe pain. Usually, it's pain and numbness. Sometimes you have burning and tingling. Sometimes you have all of them at once because you're causing nerves to fire that shouldn't be firing, and those nerves that are firing tell you that this hand hurts, even though the nerve is being irritated up here in the neck region. It still feels like your hand. It still feels like your arm. You know, you could call it phantom pain, call it whatever. It doesn't make a difference. Your brain's registering it as pain, and it hurts to you. So what do you end up on? Pain pills. I don't object to that. Being a chiropractor since 1978, you think that I'm going to fight over medications, and I don't like the abuse of medications, of course. But with fibromyalgia patients, most of them would kill themselves if, you know, the severe cases, if they didn't have something to help them, you know, like pain pills, anti-anxiety pills that helps the sympathetic nervous system, sleeping pills so you can get some sleep. And what we see during the course of treatment is we see these medications kind of slowly taper off. And the reason for that is because the receptor sites, as we take the pressure off the meninges, day by day it gets better and better. When we do that, the receptor sites close, they don't need that medication, and you can cut back on the medication. Now, I'm not giving you advice on this because I'm just telling you that this is what happens. And I work with the medical doctors who are the ones who put the patients on the medication, and they help them slowly get off. If not, we can get them to a doctor who can do that. So that's not my job. My job is to help you get over your fibromyalgia and return fully to health again. That's what I do. But the medical doctor's job is to help you get off the medication. So let's be clear on that point. But during this, when you're getting better, the medication slowly can be tapered off, and then you don't need it. And you don't have all of the withdrawal symptoms you would if you would just stopped it or tapered off without taking care of the fibromyalgia symptoms. So now this pulling up here is now causing pain. We watch the progression of fibromyalgia, and most of the time it does progress. And it starts up here usually. I've seen it start in the low back. I don't even know how that works. But anyway, it usually starts up here and it slowly gets worse. And as it does so, it goes down into the low back, into the hips, and then into the legs. By the time it gets in your hips, almost all patients are disabled. They are so sick with the other symptoms on top of just the pain. A lot of people could deal with just the pain, even though it can be horrendous, but they can't deal with that and the insomnia and the depression and the loneliness. All of this causes you to be so tired, you don't have time or energy to, you got lots of time usually sitting around the house, but you don't have the energy to take care of your friendships. You don't have energy to keep your marriage up. You don't have energy to take care of your children like you should. You don't have energy to take care of just normal daily activities. So when your friends come over and want you to go out, you go, God, I just don't feel like it. I feel miserable. I can remember having friends over and just getting up and going to bed right in the middle of friends over or having a party or something. And you're just so tired. So after a while, your friends get tired of coming over because you never want to, you can't even sit there and talk to them very long. And if they're very loud, it hurts you, it aggravates you. If they talk too much, you get irritated. If they turn the lights on, it bothers your eyes. I mean, you just don't feel like having that type of relationship. And so that is what causes you to, and this is some of the causes of what happens. This is why you end up with no friends or very few. The very few people understand. And if you have a fibromyalgia friend, call them every day. Go by and visit them, even if they are tired. Just stay for a short time if they don't feel well. But don't let them just be alone, because that's normally what happens. They end up feeling alone. Oftentimes their family doesn't understand them. Their friends don't understand them. Many doctors are very cruel about how they're treated. And so if you've got a good doctor, stay with them who understands you and loves you, because they're like gold when you have fibromyalgia. And so that is why you feel like you do. It's because you've got so many nerves firing at all at one time that is causing all kinds of weird symptoms as far as pain, tingling, burning. I've had some patients, their hands on fire, their feet were on fire, some of them are freezing. It just all depends on how everything works. Now, the other thing that happens is because this is not just caused by one thing, and that's what we thought when we first started it, when we were treating everybody, kind of alike, and almost everybody was getting well, but there was a lot of people that didn't. And so we finally figured out that there's different types of movement can create different types of symptoms. So a patient, for instance, who has a pulling on the front of the meninges can have facial pain. Trigeminal neuralgia is real common with this kind of a patient. And so this is one of the reasons why trigeminal neuralgia ended up being on our agenda, was simply because so many of them got well when we were treating the fibromyalgia. So the trigeminal neuralgia will often respond very, very well during the test, and many times the pain will just disappear during the test. It doesn't stay gone. It wants to come back. And how long it takes for it to come back tells us how often you need to be seen, kind of gives us some kind of idea of how long it's going to take for you to get well, those type of things. But the trigeminal neuralgia it can be horrible. I think I mentioned in one of my videos that one of my patients pulled her teeth out, thinking because her teeth hurt so badly. And it just made it worse. It didn't make better. And she responded well to treatment. The RSD is a different animal completely, because it has a tendency of starting after an injury. Let's say you injure your knee and that RSD starts cycling and it hurts. So you have surgery. The doctor says, well, I see what's wrong with your knee. I'll fix it. And so the doctor that's fixed it actually does a good job, fixes your knee. It hurts worse than it did before. Now maybe it swells up. RSD can get so bad, your whole leg can swell up. Some people actually have their legs amputated. It gets that bad. And I've seen cases of RSD I couldn't even touch. They were so bad I couldn't even get a handle on it. But most of the time, the RSD would come along with the fibromyalgia patient. It was just one more problem they had. And the RSD would disappear when the fibromyalgia disappeared. And then sometimes after a while, we started having people come in with just trigeminal neuralgia, just RSD, and started having pretty good results with it. I don't have as many studies on RSD and trigeminal neuralgia. I'm going to put it out there that we've seen some good results with it. I do have studies. You can pick those up right now off of the internet, and the studies, and if not, just write me and I'll be glad to write you if you can't download them for some reason. And I'll send it back to you. I got a 200-page study on 74 patients that has every symptom in the world on it. And what that symptom did on each individual patient before and after. You can take a look at it patient by patient, or you can take a look at the overall results we had during treatment. Now, this study included a lot of people who had other problems like football injuries to the knee and things that aren't going to get well after your fibromyalgia disappears. So we had some residual symptoms, and our overall correction was of the symptoms was a little lower, but it still hit like 77%, which I think is amazing. I'd be happy with that just for the fibromyalgia. But if we tuned in on the fibromyalgia symptoms, we have another study, and this study showed that about, if I can remember it exactly right, it was over 80% of the people were 85% symptom free by the time they went home. And I'm really proud of that. And then some of the people, of course, were completely symptom free and so forth. But you can take a look at that study as well. I'd be glad to send these. Feel free to contact me. And, I leave my phone number on a lot of my videos at the end, have my phone number and so forth. And of course, even just the channel here has my email address. So you can always reach me. I'm really happy to talk to you. I am not the kind of doctor that gets irritated when you call me. I love talking to my patients. I had it myself. I noticed like I have great empathy for what you're going through. I don't know if I have missed anything at this time, but I'm really happy with the fact that you tuned in and that you're watching my videos. And I'll make sure that this gets archived so you can watch it anytime you like. Share it with a friend. And thank you so much for joining me today. And really happy to be able to help in any way. This is my mission. Please join me. Help get the word out that people are getting well, and get the word out to your friends. Invite them to look at my videos, invite them to our live events, and invite them to participate. Write me. Let's see what we can do to get the word out. This is crazy. It's been 20 years now, thousands of people, and you still don't hear about it. It's horrible. It's horrible. It's so difficult fighting against the establishment to get the word out on this. And I'm doing grassroots. I'm going back to the patients. And so hopefully we can all make this our mission together and help people. And thank you so much for watching. I'll see you next time.